There is something that more than 39 million men in the United States suffer from. Erectile dysfunction, or ED, can be devastating for both a man and his partner. But today, our next guest is here to explain some treatment options available. Please help me welcome Dr. Dr. Mutter. He is a board certified urologist and an assistant professor of urology over at LSU. Welcome to the show, doctor.
Thank you. Glad to be here. Thanks, Malik.
Glad to have you here as well. As a man myself, I am very interested in this conversation. First, let's start at the beginning, right? What are the causes of erectile dysfunction?
It's a great question. And first, to really understand what can cause erectile dysfunction, we really need to know a little bit about how an erection works. And the long and short of it is that it's just an increase in blood flow to the penis. So if you think about it, anything that can inhibit or decrease blood flow to the penis can be a cause of erectile dysfunction. Unfortunately, it's things that can occur from having, enjoyment in your life. We're talking things like diabetes, hypertension or high blood pressure, smoking, these sort of things. Another almost uncontrollable cause of erectile dysfunction is a prostate cancer treatment in the form of radiation or surgery. And for many other men, any type of colorectal cancer treatment as well can be the cause of erectile dysfunction.
And of course, I want to ask you, doctor, what age do we kind of start seeing this happen for men, just so we know?
Believe it or not, as men reach the age of 40, about 50% of men at age 40 will have some component of erectile dysfunction. Now, we're not talking full-blown inability to achieve or maintain an erection, but maybe some component. Maybe they'll start to notice that their erection may not be as rigid as it once was. But around age 40, believe it or not.
Wow, 40 years old. Good to know. Now, there are some different treatment options, like I said at the beginning, that you want to discuss this morning. Right now, there are 5 FDA-approved ones. Tell me a little bit about those.
Sure. So the first and foremost, when you see your practitioner and you bring this up, really we should at least be talking about behavior and lifestyle modifications. Things like if you smoke, stop smoking, or at least work on smoking cessation, improve your diabetes, improve your hypertension, increase your exercise. That will improve your mood. It will improve your mental well-being, and then in turn may help combat some of this erectile dysfunction. But obviously that is much harder said than done. It's easier to say than do. And so at that point, we can start talking about treatment options. We're talking things like Viagra, that's the oral medication, Cialis, those sort of things. But to take it a step further, we have things like injection therapy, and it's just like it sounds. When you want an erection, you give yourself a small little injection in the side of your penis. It sounds pretty terrible. It sounds like it'd be very difficult to do, but I assure you it's not that big of a deal. Next, we have vacuum erection devices, lack of a better term, is a penis pump. This works very well for men, but it can take a little bit of practice. Following this, we have urethral suppositories, and that's nothing more than the same medication that you would inject into your penis. You actually put into the tip of your penis, and the medication is delivered that way. And then finally, we have penile implants. Now, I do want to make note that these are in no particular order. Once a man fails the oral medications, any of these treatment options are available. There's no stepwise fashion that you have to continue to fail different medications to then be approved for another one. Once you're no longer responsive to the medications, or if you're unable to tolerate the medications due to some sort of side effects, because side effects with the medications, while common, they're not terribly severe, but there are men that can't tolerate these.
And let's talk a little bit more about this penile implant. We actually have a picture we want to show everyone. What's the satisfaction rate when it comes to the implant? Is that the one you suggest the most?
Well, I'll tell you that a penile implant is the gold standard treatment for erectile dysfunction. And the reason being is that when you want an erection, the device will help you achieve and maintain your erection for as long as you want. The way that this works is there are several different types of penile implants, but the one you have here is what we call an inflatable penile implant. So if you look up the top part of the picture, there is what we call the reservoir. This is what holds the saline or the fluid that is used to inflate the device. That sits up next to your urinary bladder, and so you can't feel it or see it. And then the 2 cylinders go in each side of the penis with the pump going in the scrotum. Now, the other thing that's important to know is that you could walk around, say guys who go to the gym and then they work out and they take a shower after. You could walk around in the shower in the gym and no one would have any idea that you have this implant in place. It does provide a very natural looking penis, even with the implant in place. And the way it works is you pump the ball down at the bottom, the little bulb. The fluid transfers from the reservoir into the cylinders, providing a very rigid, natural appearing erection. From a satisfaction rate, the satisfaction rate is greater than 90% for both patients and partners. So it's a very satisfactory device. It is a very good treatment for men with erectile dysfunction that perhaps can't tolerate the oral medications, or they're no longer responsive to the medication, but yet can't bring themselves to do the other types of treatments.
It really is an interesting conversation we're having this morning. So many different treatment options available, which is good. And Doctor, I want to thank you so much for joining us this morning to discuss these treatment options. And look, you want more information about the available treatment options and what insurance does not cover when it comes to erectile dysfunction, log on to nolamenshealth.com or edcure.org. You can also call 504-412-1600 or pay them a visit at 3601 Homer Boulevard, Suite 302 in Metairie. And guess what, everyone? There is a free men's health webinar coming up on April 7th at 6:30 p.m. To register, you can text webinar to 72345. Stay right there, everyone. We'll be right back.